Welcome to The Whole View. I'm Stacy Todd, the Real Everything. I'm here each week to dive deeper into how we can find happiness and health inside and out through self love, body positivity, and discovering new ways to be our best selves. Before we get started, a reminder this podcast is for general educational purposes and is not intended to diagnose, advise, or treat any physical or mental illness. And while Dr. Makkar is a dentist, she's not your dentist. So we always recommend that you see a licensed health professional accordingly. That said, listeners, I want to introduce you to Dr. Parul Makkar. I keep saying parole, but it's not parole. It's like, I love that you said it's like Carol, which is my mom's name. So it's
Oh,
Parul Makkar. And you are the founder of PDM Family Dental on Long Island, New York, and the recipient of the Denobi Awards in 2022, as well as the LI Excellence in Healthcare for 2022. I'm excited to hear more about what those are. And I found you through your story of losing your younger sibling, a fellow dentist, to oral cancer. And now you have devoted your time to educating not just patients, but doctors alike about risk factors, prevention, and advocating for early diagnosis. You've co authored the book Life Interrupted, Dr. Dua's Survival Guide, which is also a winner of the SIPA Evie Award for motivational inspiring books. So you're just checking all the boxes. I'm so excited to talk to you today. Thank you for joining us. What didn't I cover? Can you tell us a little more about yourself and how these awards came to be and your story?
thank you, Stacey, for having me. First of all, delighted to be here. So I'm a general dentist, a mom, business owner, wife. I wear all those hats, like most of your listeners probably do, as a working mom. And my life trajectory kind of changed when I lost my younger and only sibling. And I think that is something beyond comprehension, or you don't expect your life's trajectory to be that way. He was almost 8 years younger than me, so never in a million years would I have counted for this. And he died of oral cancer, and he was a dentist like myself, followed my footsteps. We took courses together. So the fact that it was oral cancer, it's our field. And I didn't, he lived in Canada, I lived in the US, and I didn't want his loss to be just a statistic that here's another person who died of oral cancer, just preventable. And I wanted it to be a movement. And since instead that's what I've been doing, and thus came all the awards. I was recently, even with the Indian American, because I'm of an Indian descent, I was given a Women of Achievement. And just last week I was awarded Healthcare Heroes. And that's but New York, there's a community, was based with lots of other doctors or healthcare professionals. So it's just been, the awards have come. It's not something that I've reached out for. It's just my work and just feeling that whatever I've been doing has been reaching and hopefully changing the narrative and saving somebody's life. And it's just a recognition that, yes, my voice is being heard.
I totally understand where you're coming from, and I appreciate that you've incorporated this into your work and are educating others. I want to acknowledge the loss of your sibling. We in our home have also lost a younger sibling, and it was very, it was traumatic. It was unexpected and earth shattering. And like you said, just completely unexpected. And you never know, you know, where that's going to take you. And I think it's interesting how that story weaves for me because his life was lost on a mental health front. And my work here really expanded from food and physical health to understanding brain and mental health and the importance of that as being a whole person after his loss. And it's really given me a different kind of direction and sense of purpose and all that kind of stuff. So I really relate to what you're talking about and appreciate the work and the effort that you're doing to make his life something that's remembered and something that can help others. So thank you for all that you're doing. And can you share us more about that and how it influenced the way that you're approaching specifically oral health and maybe your regular work, not just your advocacy work?
Sure. So oral health is really linked to overall health, right? If we don't have good bone, of the teeth. It's not got a good support system. You end up losing teeth. Bad breath. It's linked to diabetes. It's linked to heart conditions, linked to Alzheimer's, dementia, a host of things. Even during pregnancy, it's so important to have. So, and if you don't have a good oral health, you're in pain, it's hard for you to consume foods. And so it affects what you're eating, your intake, your confidence level, if you're not able to smile well. So it's a host of things. So, and it's all linked together. It's not like people say, oh, I have a cavity. I don't need to get that fixed. It's fine. It's not hurting. Unfortunately, it can grow and become other issues. And so, it's not like your mouth it's completely unrelated. So that is a huge aspect of what I do. And I see my patients, I really hone on educating. This is what we have. This is what I see. Take pictures, show them intraoral camera. Like, this is what I see in my mouth. You don't see it, but I want you to know what it is. And, talk about self advocacy, know what the risk factors are if we don't do treatment or we change what kind of treatment we pick or do no treatment. They're all, pros and cons. So, educating my patient, having honest discussions, not about just oral cancer. Yes, screening more regularly. Like, I would screen patients when they came in for their recall appointment, but, bringing this to the attention that I'm screening practically every visit. Like, when I see something, I'm like, even if I didn't notice at their recall appointment, if I see them on their filling appointment, I'm like, I didn't notice that, when you were here 3 weeks ago, but now I see something. And so it's a lot about education and advocating patients to advocate for themselves and make informed decisions rather than just saying, hey, I've got the white coat, I've got the degree behind my name, and whatever I say goes. That's just not the way it is. So a lot of it is education.
Yeah, I appreciate what you said about dental health being linked to overall human health. One of the things that originally was very interesting to me and kind of had me go down a rabbit hole when I was learning more about healthy living and lifestyle and all that kind of stuff was work related to communities who have great health generally also have great oral health, right? Like, and when we see dental issues, we can also anticipate or link them to a host of other issues. And, a simple explanation, and it expands a lot more of this, that kind of was like an aha light bulb moment for me was TMJ, right? If your jaw is not in alignment and you are grinding or you're chewing weird or you're creating whatever out of alignment issue in your jaw, it can lead to, for example, headaches. And I think that's an easy thing for people to understand. But I'm wondering if you can kind of expand on that into more about how we see dental health being linked to overall.
Yeah, you brought up a great point, TMJ. I mean, this is the big joint that's right here. And you can actually put your fingers through your ear and actually feel it move. And some patients may experience clinking. They may have pain, waking up, headaches, like you said. You can have a neck pain, jaw pain. It's hard to sometimes chew hard foods because your joint, when we're chewing, we're extending like 600 pounds of pressure every time we chew. It's an extended amount of force. And teeth are stronger than bone structure. Okay. We're, our teeth are just, and yes, TMJ is related. It affects how you eat, how you chew, headaches, waking up, migraines, a host of issues. And you end up having to either get an appliance to fix it. Botox is out there. You can do PT therapy, which is basically some exercises, just like because it's a joint, like any other part of your body, your knee, your shoulder, you'll hurt it. You go through physical therapy. You can do that. Your hot compresses, cold. So there's a lot of treatment modalities, but getting that jaw back to the alignment, that's kind of, how you would go to get corrected a car. If it's not aligned properly, the wheels, and it's not functioning properly, you feel it just like that. Your jaw, if it's not aligned, you're not able to chew. And other factors, if you have bacteria in your mouth, for example, from not brushing, everybody gets plaque buildup right away when they brush their teeth, after eating, get a plaque. That's just the way it is. But if you don't effectively brush your teeth and floss in between your teeth, that hardens and that becomes calculus. And that you can't remove with brushing. That's something that you come into the dentist. And that is bacteria that's harmful. We have bacteria, we have good bacteria and bad bacteria, but that calculus bacteria is the bad bacteria, and that can start kind of eating up on your bones and can start loosening your teeth or bleeding gums. So, if you're brushing and you get like a spot of blood, maybe you kind of hurt yourself while you were brushing or you had a sore or something. But if it's like excessive amount of bleeding, you wake up with blood on your pillow, you have some puffy gums, these are all linked to periodontal disease, which is gum and bone disease. And that bacteria can go and affect your heart, especially if you have any like artificial heart valves or have had stents or so it affects those. It can affect stroke. It's been linked to people having brain, with stroke. It can be harmful to any artificial joints that you have. And that's an important thing that when you get an artificial joint, whether it's a knee, hip, you let your dentist know because that bacteria, if you're doing a cleaning, that bacteria can travel and harm. So you need to be pre-medicated. So it links to everything. And, this is besides halitosis, but getting cavities and getting that, when you get a small cavity, it doesn't hurt because the nerve of the tooth is in the center of the tooth. And so when you get a cavity, it won't hurt until it grows and it starts to become a little sensitive and you're eating like hot and cold, and then more to as it progresses to excruciating pain or swelling or discomfort. And that's when the tooth ends up having to be a root canal. And this is what I tell my patients when I see a cavity, I want you to treat it and be more conservative in your treatment rather than wait and delay treatment. And now we're looking at a possible root canal. Sometimes the tooth can break and fracture and you need an extraction. And if you don't have a good oral hygiene, these things are communicable. So through kissing, if mommies are kissing their babies, they can transfer these bacteria to their babies or to the other people. So it's so important. It's linked to everything, even diabetes. If your diabetes are not controlled and you don't have good oral health, it's just going to make your diabetes even worse. So it's linked to a whole range of conditions.
I am interested to hear. I know you said that when you're talking to other practitioners that you encourage them to be more conservative and to take care of things that they're seeing in the mouth before kind of seeing, oh, could that resolve itself. I think a lot of what I have heard in the wellness space is, well, wait and see and try to remineralize the tooth. And I know you also practice traditional care as well as holistic approaches as appropriate. Can you share more about what that looks like when you're approaching dental care from as holistic as possible, but also truly putting wellness and safety first and where you draw the line?
So so a tooth has three layers. The outside is the white that we see, that's the enamel. Then the second layer is the dentin, which is a little yellowish. So if people who have grind their teeth down, you'll see them, that's a little bit yellower. And then the center of the tooth is the pulp chamber, and that's where your nerve system is and your blood supply is. Now, if I see a cavity that's kind of just in the borderline of like the enamel and the dentin, it's right there at the junction, I may watch that. I may say, okay, you got to floss more, maybe use fluoridated toothpaste, have some other precautions to try and arrest and not go into treating. The thing is, the tooth cannot heal itself. We get a cut on our leg, we get a cut on our arm, we burn ourselves, that tissue will heal. We cut ourselves in the mouth, the tongue, you scrape something, you ate a hot pizza, you took a sip of hot coffee, you burnt your tongue, you cut a part of your cheek, it'll heal within 2 weeks. But a tooth, you break it, you fracture it, it gets decayed, will not self heal. So it needs to be treated. So when a cavity is progressing and it's not at that junction and it's not in the enamel and it's not right at the borderline and it's spread into the dentin and it's, it's getting bigger, that's when we need to restore it with a filling. So holistic dentistry is there, but it has certain limitations. I then do traditional dentistry, of course. I don't, with holistic, I'll tell patients like, hey, saltwater rinses, you could do that at home. You can, if you have a toothache after an extraction and it's bleeding a lot, you can take a tea bag and bite on it instead of, to help with the bleeding to stop. Maybe not prescribe opioids and narcotics after an extraction. There's a different regime that we can use. Clove oil helps with toothaches, with kids and stuff. You can take a gauze and put it instead of having to give them medication. So there's uh, there is a way to do holistic dentistry, but sometimes, you know, unfortunately, a tooth will not regenerate itself and will not heal. Sure, there's stem cells research out there, but getting that, like, you can't. There's certain things you can't treat if you have heavy plaque buildup. Yes, control your control your brushing and flossing and all of that at home. But if you are getting to the point where it's a lot of bleeding and there's heavy calculus and there's heavy buildup and you have bad breath, then you need the scaling. You need all this stuff. So it just depends to what degree it is and how much we can treat at home. There's certain limitations to it, and you kind of have to come to the traditional dentistry.
So when you said that teeth can't repair themselves, like totally get that on cracks and breaks and all that kind of stuff, where I have seen people show before and afters of an x-ray that this is what the teeth looked like. And I think it's kind of what you were talking about, right? It's not a full cavity deep into the tooth, but it's more wear on the dentin. And so there is there are people out there who are saying you can remineralize that enamel layer of a tooth with toothpastes that or different kinds of mouthwashes and different things that you can do, changing your diet to be less about the negative bacteria and leaning more into the positive bacteria, these kinds of things to improve that outer layer of the tooth. And because it's a bone, we know what the bones in our body can, not remineralize, but to rebond. Can you kind of walk us through what the difference is with teeth and what's real and what's not real? Like I'm torn between, people posting pictures on the internet who have no credentials at all, but are also like, an x-ray is an x-ray. And then what I'm hearing you say. So
Well, you have to know where your source is coming from. The internet is wild out there. It's Wild West, right? I mean, there are
especially these
people,
days with all the
yeah.
AI stuff and yeah,
I
no,
mean,
I hear
oh
you.
yeah. And there are people out there who believe the earth is flat, so, and you can prove any point either way. But I don't know what pictures or stuff there are, but you have to see where the sources are, what studies are done, who is doing the research behind it. Is it somebody who, like you said, is it somebody who's credentialed? Is it a scientist? Not necessarily a dentist, but, has some science background, knows what they're talking about, and knows how the body works. Or is it just somebody who's experimenting and seeing things? Because who's taking these x-rays? So yes, what you said was remineralize enamel. You can, to a certain degree. You can make it harder, and that's where fluoride comes in. Fluoride binds to the enamel layer and makes it more resistant to decay. And it's been proven by, the FDA, by the ADA, the American Dental Association, by World Health Organization, the impact of fluoride and having, again, too much fluoride is bad for you. It's 1 part per million in your water that you're supposed to have. And how much toothpaste? You're not supposed to be ingesting huge amounts of toothpaste. It's a small, everything in moderation. So yes, you can remineralize, and especially if your diet is like, if you're doing a lot of sodas, which is highly acidic, you're drinking water, which is great. But if you're drinking carbonated water, the pH level is kind of, low on that. It's acidic. So you stay to alkaline waters or just regular water. And how much sugar are you consuming in your diet? Sure, you're not having cookies and cupcakes and so on and so forth. But you're drinking coffee, maybe 3, 4 cups a day. How much sugar are you putting in them? how much sugar is being bathed around your teeth. Maybe you drink less sugar, avoid it, or use a straw so you have less contact on your teeth. The whole idea being prevention. And that is also linked with, if you're getting more sugar or acidic content, our salivas are buffers and the natural, it like neutralizes. But if it's constantly subjected, then the teeth start to break down, they get sensitive, and that's when you remineralize the enamel. But you cannot grow like a cavity when it happens. Yes, you can remineralize, you can use, there's so many things out there. There's MTA paste, there's, like I said, there are different types of fluoride toothpaste out there, mouth rinses. You can do all that to arrest the decay at a smaller point. But if it's gone to the point where it needs a root canal, that needs a root canal or an extraction or some more definitive treatment. If it's spread beyond the enamel layer into the dentin and the pulp, then we're not talking about remineralization. We can't arrest. There is a new product out there, which is SDF, silver dihatamine, and that helps arrest decay. And again, we're not remineralizing the tooth. We're not doing a filling, but we are arresting the decay, and which works really good in people who are elderly and they have hard areas that we can't, we're trying to hang on to the tooth as long as we can. And maybe their health condition prevents them from getting dental treatment, or little kids who can't sit in the chair and you don't want to put them to sleep and you want to just do something a little bit more conservative. So we're not drilling into the tooth. We're just kind of clean out the decay and then apply this SDF just to arrest the decay. But it needs to be done at a certain time, like every few weeks or a few months, until more definitive treatment can be done, like the tooth falls off or something in a child. So there are other ways to help be more conservative in treatment rather than being aggressive. A lot of the dental materials, we walked away from amalgam, which needed the prep had to be more bigger, to like more conservative composites that we're not removing healthy tooth structure and preserving more. We want to preserve as much of the tooth structure as we can because tooth structure can't be replaced.
So you talked about fluoride. I feel like it's a can of worms in the health and wellness space. And we did podcast previously. I'll put a link in the show notes talking about the science, which you can look at both negatively and positively in terms of, like you said, too much fluoride can and is known to be detrimental to the health. At the same time, we know that there is health benefit in certain situations, like you said, helping to remineralize or strengthen the enamel layer. Growing up, we used well water, so we didn't have fluoride in our water, and I was a young child with a rebel tendency, and when my mom would tell me to brush my teeth just because I wanted to stick one to the man, which really it wasn't sticking one to her, it was getting me back. I would fake brushing my teeth by like, putting toothpaste on my like the inside of my lips so that my breath smelled fresh when she checked it, but I wasn't properly brushing my teeth regularly. And I ended up with a ton of cavities as a child. And I think it really, fortunately, they were all my baby teeth, and I learned a lesson and have had good oral health since. And it wasn't really until I myself was a mother and had to choose, do I want to give my children fluoride toothpaste knowing that they're like eating it and they don't know how to properly use toothpaste, but also if I don't do that, what happened to me? And all of the, you know, dangers that are probably exaggerated a lot of the time. I think just the internet in general, right? To get someone to click on the article and to read can really make an exaggeration of circumstances. Like, walk us through what you think that balance is when you're approaching things from like a health minded mindset, but that doesn't necessarily mean all or nothing, right? Like it sounds like there's a balance for you. What does that look like?
Right. So I get a lot of patients like that. So interesting you brought up about well water. that it does, well water does not have fluoride. And people who are grown up in well water do tend to have a higher rate of cavities. And I always tell my kids, my kid patients, that you get two sets of teeth, one to practice on and one to hold on for life. So if you lose a baby, you get a cavity, it's all good. We'll treat it, we'll take care of it. But, let it be a lesson that you got to take care of your teeth because you're not getting any more teeth back once you've lost this one, the adult tooth. So, but in New York, the water in the city, so the five boroughs in New York City is fluoridated. But in Long Island, where I live, the water is not fluoridated. And my children get fluoride supplements from their pediatrician. And that's something you would talk to your pediatrician. Again, all these decisions, there's a whole host of things. And, it is opening a can of worms, and that's not my intention. But really have that discussion with know what your water is like, know what consistency is. You can run water reports, you can get it from your town, and talk to your pediatrician if for a child, or your doctor and your dentist as to what the best course of action is for you in particular. Because everybody is, I focus on individualized care. Not It's not the same set of treatment I tell to everybody. So everything is very specific. And for children, if they're not able to spit, you know your child best. If they're not spitting, maybe you don't want to use the fluoridated toothpaste on them. They're going to just swallow it. And then you're concerned about the high consumption of fluoride. And, they make the toothpaste for kids that you can use. Now, the ADA, the American Dental Association, says you can use fluoridated toothpaste on children who cannot spit, but that's your choice. Again, you make the informed decision. And the amount of toothpaste you use is also varied. So for a little kid who's not able to spit very well, you're using like a grain of rice. So think about how small that is. And then when your child gets a little bit older, 6, 7, you can use a pea-sized amount rather than how much we're blobbing onto our toothpaste. For children, you want to keep the quantity of toothpaste that they're using smaller. If they have fluoride rinses, just see where it is that they're not sitting and drinking that. So it's just access to the care. It's using the smaller quantities. But yes, fluoride has its place in dentistry. It has been proven. Again, it's a lot of a lot of fluoride consumption can cause fluorosis and actually cause the browning of the teeth. So you don't want to go too much over. It's in small quantities. Make sure you're brushing and you're spitting out all that. You're not consuming it. And that's really important with the children.
What would be some symptoms too much fluoride?
It would show up. So teeth start developing inside, like baby teeth start developing when we're still in the womb. And the adult teeth start developing when the child is born. So if the child is consuming a lot of fluoride, it can affect the coloring of the teeth as they're older. So you'll see that difference as the teeth are up. But let's say your kid swallowed the toothpaste bubblegum flavor, yummy, and they swallowed it, they're going to have an upset stomach. They're going to have throw up. You may neutralize it with drinking milk and, call your hospital. But it'll be a lot of upset stomach. But usually the fluorosis will be the discoloration of the teeth and when the teeth develop.
How do you feel about, or how do you talk to your patients who have relatively good gum health and oral health? So, setting aside people who are needing root canals or have gum disease or anything like that, let's put them, in a separate category because they need kind of triage care versus preventative care. So, when we're looking at someone who is, for example, a lot of our listeners are filtering their water to get rid of a lot of different things that are in the water. They may be trying to filter fluoride so that they can control how much is consumed. They also, I know, like my mom lives in a county where there's a PFAS advisory and the county recommends not drinking the tap water unless it's filtered, right? So we know that there are filtered water that might replicate that well water situation. And then leveraging like mineral based toothpaste, for example, the brand Risewell comes to mind. There's a lot of different, like David's, there's a lot of different even name brand, I think like Tom's and different kinds of brands. Burt's Bees also offer like fluoride free toothpaste options. And I know my dentist, which is a traditional dentist, actually recommends this dental herb company tooth and gum tonic that is not alcohol based, but has a lot of like herbs to help just as a mouthwash, not as a replacement for brushing your teeth or anything like
Right.
that. But instead of like the bright green kind of alcohol based mouthwash,
Right.
that's the one that they recommend. How do you feel about a lot of these things? And if they have a place, like what does that look like in a general routine for someone who's trying to optimize their oral health?
So anything, I mean, there's now a new trend, so to speak, about toothpaste tablets, and a lot of healthcare people are having it because it's, there's no plastic use, it's less wastage because you just chew the little tablet. And a lot of them don't have fluoride, some do. Again, I am more of a traditional dentist, so anything that I would recommend, make sure it has the ADA seal, the American Dental Seal on it, because that's been tested and it has been proven efficacy and it's efficient and it's consistent producing results. So if you that's the one big advice I would say is that whatever product that you choose, whether it is a mouthwash, a floss, a toothpaste, any other adjunct that you use that has the ADA seal on it. As far as, and I think your dentist said it well, that you can't replace brushing and flossing. There's just no other alternative to taking care of your teeth. However, you can use the other adjunct processes to do it, and it's just like when you practice, like if you need a knee surgery, it's not going to heal, the knee's not going to heal on its own. Yes, you can do other things to help it and do something non traditional, but you still need the surgery. And it kind of goes with dentistry too. You still need to do what you need to do. You can use other things to help. Absolutely. It can be used as an adjunct. But yeah, non alcohol based mouthwashes are great. Some do, like Crest has some that are, I don't want to name names, but there are, if you look at the labels, they're ADA approved non-alcoholic, which I think are really great, especially if people are going through, substance abuse and they are, abstaining. You don't want the mouthwash to have it, right? And especially in young children, we've seen that. So yeah, you can totally use other products. And I have patients who come and people, and you brought up another point, like people who have healthy teeth and healthy gums. I have patients I have like and I'm sure there are people out there who feel like, oh, it's not fair, but it's people who are like, I come every 6 months I'm here, or every 3 months I'm here for my deep cleaning, and I brush and floss, but you know what? There's another new cavity, or the gums are still not there. And sometimes it's genetics plays a lot of factor to it. Genetics, our upbringing, where we brought up, all of that makes a huge difference. And then there are people, I haven't been to the dentist since the pandemic, and it's been 3, 4 years now and they have not a single cavity in their mouth and they've never had a filling in their mouth and they just have great teeth and they're just lucky. Yeah, I don't know.
It's
Yes,
me. Confession time. Like, part of why I think this show is important is for me because I really don't like going to the dentist. There's something about, I think, the vulnerability. It's also like my mouth isn't very large. And so when they're working in there with their hands, like it physically hurts the sides of my mouth. And it
right.
took me a while to find a dentist that was providing compassionate care and like understood those things and took them into consideration and made me feel comfortable enough to want to go. But I avoided the dentist, I want to say almost 10 years, and it was while I
Wow.
was pregnant and nursing. And it wasn't until I finally felt that I had one cavity after I was done nursing 3 children that I was like, I have to go and I have to get this taken care of. I have to find someone who will help me. And they were shocked because they were like, I cannot believe you don't have gum disease. You don't have,
Right.
yes, you have this one cavity, but like, I think really I took oral health so seriously after my scare as a child.
That
But compared to my husband, who like has an electric toothbrush and a water pick and like goes every 6 months and he constantly has issues with his teeth. And I'm just like, I know that I'm taking good care of my teeth when I brush it, but also, like, I didn't go to the dentist for many years and my teeth are fine. That's not listeners, it's not an encouragement. Children, if you're listening in the car, don't do what I did because, I mean, I did end up with a cavity, but I also think that I would have ended up with that cavity even if I had been going to the dentist just because of the minerals that are leached from women's teeth when they're pregnant and nursing, which I also want to talk to you about. But so I didn't mean to like interrupt you, but you were like, there are some people, and I was like, oh, I'm that person. I'm sorry.
I see them all the time. They're there. And, for them, I'm like, okay, you want to come once a year? That's fine because you have, healthy gums and bones. And, but some people are like, no, I need to see you every 3 to 4 months because if we leave it for a year, it's going to be a disaster. And this is what I talk about custom care. And it's not like one thing fits everybody. It's approaching the patient. What are their medical conditions? What are their downfalls? And, you brought up a good point. Always recommend an electronic toothbrush because it does a more efficient job of brushing and it can get into like hard to reach places. And when we're brushing, we want to make sure we brush in the back of her teeth as well, either top of the teeth, not just the front. And sometimes that's hard with a traditional brush and a water pick, water flosser for people who are unable to, if you have braces or if you have dentures or like bridges or implants and it's hard to floss in between, or you have dexterity issues and you can't actually do the flossing, and water pick and water flossers are awesome to do so. Yeah. I think a new study just came out that water flossers are even better than just regular flossing.
Yeah, that makes sense to me. I This is a complete aside, but it like occurred to me just a week or two ago. I was thinking about a bidet, which has a completely different situation, but I think it's relevant here as not only are we talking about actually like rinsing off the tooth or wherever with water as being the thing that's cleaning it, but it occurred to me that like the oxygen boosting things that we add to our laundry that get them so clean are doing so because of oxygen, and water is hydrogen and oxygen. And so there is actual cleaning benefit with the water in addition to it actually rinsing. I don't know why that was like a light bulb moment for me that like the water itself is has cleaning properties and isn't just like rinsing off the surface, which is how I always thought about water. But like if you're able to get water into between the teeth and flush it out, obviously that's going to be
Right.
better than, you know,
Right. And,
floss.
and oxygen is great for you. I'm talking about the oxygen chambers that you can help with people who have burns or people who are going through tremendous surgeries as a healing. It's not commonly used, but oxygen therapy is out there and, we need it to survive. So yeah.
I think while we're talking about products, before I move on, because I do want to talk about how teeth are affected specifically for people who are creating life in their body, whatever that looks like, whether they're, pregnant or nursing or, the body is prioritizing in another sort of way. I do kind of want to just quickly talk about products. So you said look for the American Dental Association emblem. I
Yeah.
think one of the other things that I want to take a moment to educate people on, and I'm curious if you're aware of this, is that not only do we have the sustainability issues with things like toothpaste and floss, but oftentimes for floss specifically, it is coated in kind of toxic chemicals that can be problematic. And I'll put links in the show notes to a couple of brands, both for toothpaste with and without fluoride in our home. I do both. So my husband only does fluoride because his teeth are not as kind to him as mine are. And so for me, based on prior research, I once a day I brush with like a remineralizing is what it's called, but like a more natural based toothpaste that doesn't have fluoride. And then in the evenings, I use a fluoride based toothpaste. And our sink water is not filtered, all that kind of stuff. So I feel like that's the balance that I'm striking. Our children use a fluoride toothpaste now that they're older because they can do it properly, but when they were younger, we did not. We avoided fluoride because I would literally watch my kids eat toothpaste, and I was like,
Yeah.
"This, nope, until you can learn how to
That's
use it
real good.
properly."
Yeah.
Yeah, and everybody in the family loves the tooth and gum tonic, the mouthwash that is herb-based, and floss-wise, I just wanna encourage people to find a brand that's been tested to be specifically PFAS free, because if you're flossing, you're opening oftentimes the bloodline, right? Like many people, when they're flossing, have blood on their toothpaste. And then if you're using a floss that has chemicals that are known to be hormone disrupting or anything like that, it's going straight into your bloodstream. So there's a lot of different brands out there. I know Cocoa Floss is one
It's going to say that.
that is coconut oil and is a very traditional kind of floss. We use one that my whole family loves, and I find that it has gotten my children to floss because they're like the little floss picks, but they're made with sustainable materials. I think that it's like the plant-based plastic. Like it's yes, it's I just pulled up the link. It's biodegradable, plant-based kind of plastic. And then it's, like a traditional gum pick. And I mentioned that I have a small mouth and I don't like hands in there. And so that gets me to floss as well. Like I won't floss with like traditional floss. So that brand is called the Humble Co. And I've checked those two brands and I know they're clean. And if you have listeners, a brand that you love, like just look into it and see if they've ever tested, because you could just Google like floss PFAS and most main brands are gonna come up. That's the coating that they're using on the floss. We have to strike a balance. Like, yes, you need to floss. And can we do it in a way that's like a more sustainable product that has, not added ingredients that might be harmful to your health? And I imagine, especially with your brother, while none of these things, the thing is that these chemicals, nothing is conclusive in terms of like, this is the cause of anything in terms of oral cancer or fertility or whatever. But we just know that science is not looking favorably at a lot of these things. And so, why not improve the opportunity while also still sticking to, like you said, you do more traditional dentistry, but it doesn't hurt us to make informed, better choices as often as we can, as long as we're still able to maintain and optimize our oral care.
Absolutely. Absolutely. Yes, holistic dentistry has its place, traditional dentistry has its place, and you decide for yourself what is the best course of action. Talk to your professionals, your dentists, your doctors, and really, like you said, strike a balance. And, you have a great method because you're not at a high risk factor compared to your husband. So you're doing non-fluoridated in the morning and fluoride at night, and that's good for you and it works. Go for it. But if somebody's using completely non-fluoridated and they're going holistic and their teeth are falling apart, maybe we need to redirect ourselves. So again, everybody is different. Everybody's bodies are different. It's not one size fits all. It's customized approach and it's making educated choices to what you believe in. And, you mentioned Coco Floss. She's a part of we have a mommy dentist in business group of almost 10,000 people. So, and she's actually one of the members of that group. So I know
Oh, I
Coco
love that.
products very well. And, they're there at every meeting and on in the group as well. So yes, you know, the whole idea of flossing and brushing. So you can use, if you want to talk about sustainability, you can use a bamboo. There are lots of bamboo toothbrushes out there that are more biodegradable and more friendly to the environment. And let glass, try to find toothpaste in glass bottles or the tablets, but make sure it's fluoride in it. That's what I prefer. But the whole point of flossing is to get in between your teeth and clean. So, what kind of, whether it's waxed or non-waxed or minty flavor, but yes, it's plastic. And so if you want to be a little bit more sustainable, use the cocoa floss. It's great. So, and the whole idea is to remove plaque from your teeth. So, what kind of toothbrush, what your preference is? Yes, I recommend an electronic toothbrush. Do you need to spend hundreds of dollars and get an electronic brush? No. If you can do an effective job with a traditional, go for it. Again, it's all about there are these tablets that you can get. They're basically plaque identifier tablets, and you can chew them and see how you brush. If you can brush and get rid of all the purple stains, it stains your teeth purple. And because plaque you can't really see. So it really highlights where your plaque is and see how you brush. And if your brushing technique is good and you can get rid of that purple off your teeth, then you're doing an effective job, whether it's traditional handheld toothbrush or an electronic brush. But make sure you get in between your teeth as well, because otherwise we're only brushing half our teeth. But yeah, it's customized approach to it.
I think that's such a genius idea, even for us adults. As we get older, our mouth changes. I know, like, my child who just turned 13 is getting his 12-year molars. And so his mouth is changing, like, to make sure that we're still properly addressing and cleaning all areas of our teeth. And can we do it with a regular toothbrush? For me, I have such a hard time with electronic toothbrushes. I found one that works. And what's funny is my 15-year-old for his birthday asked for an electronic toothbrush. And it was
Oh,
like one of the things he asked for. And I was like, okay, yeah, I'll get that for you. He's the one who actually practices good hygiene. I have 4 children. I have one that practices good,
awesome
not just
for you.
oral hygiene, but like hygiene in general. He showers every day and like puts on his on his own. So kudos to him. Listeners, I'll put a link in the show notes to a lot of the products that we talked about. I have one more question about products before we move on, which is, what are your thoughts about activated charcoal in tooth products? I've heard mixed ideas, thoughts from it's stripping away the enamel to it's helping the teeth. Like, where do you stand on the charcoal?
I'm on the stripping the enamel because you know what charcoal is. You've seen it. You know, use it in your barbecues. You may draw with it. Artists use charcoal sometimes. I mean, it is a very abrasive product, so I'm not, and it can strip microns, layers of the enamel, and make it more susceptible or more sensitive. So I'm not a big fan of it. But again, it's you pick yours, you pick your battles.
Yeah, I think that, you know, there are products out there like stain removal. You do it one time or, once a month kind of thing with charcoal. And there's also like charcoal toothpaste that would be every day. And I think originally my thought process was like, oh, it's getting rid of the plaque and the stains, and that's a good thing. And then the more kind of information and research came out, it was like, and it's also potentially removing your enamel. I'm like, not what I want. So I get to hear your opinion on that. Thank you. Thanks for indulging me in all of that deep dive. I'm kind of a product junkie and I do a lot of research on that stuff. So it's always good to get a professional opinion.
Sure. Okay.
Okay. So I know we've mentioned several times about mothers and nursing, and what I have always heard, and I was a Live HA League leader, what we were taught and what we would tell people is during pregnancy and nursing, a woman or a pregnant person's body will prioritize the nutritional needs of the child, and it will literally leach out what it needs from bones, from teeth, whatever it is, to give that to the child, which is why it's often the case that new mothers often have cavities. Is there anything that we can do to prevent that? Do you find that to be true? Yeah.
Pregnancy does a lot to the body. It changes your hormones, it's changing the composition of your teeth. You can even get what's called pregnancy gingivitis, which is a healthy person may not have gingivitis, but now with pregnancy, because of the hormonal changes, they get these buildups or these puffy gums. And, just like you may have a healthy patient who will never be diagnosed with diabetes, but may get gestational diabetes during pregnancy. And pregnancy does definitely change. And that's why doctors will have you, especially when you're trying to be on prenatal vitamins, to kind of keep your body healthy while, you know, and I always I don't know how your listeners will take to this, but a child it's literally like a leash. They're taking all the nutrients, they're taking all you're providing everything to this child. They're sharing your blood supply, they're sharing whatever you eat. So it's very important to have a good diet. It's very important to take care of your oral health during pregnancy and to keep up with the vitamins as recommended by your doctor, your OBGYN. And also, during nursing, same thing. You want to be hydrated. You may want to supplement. I think I used it. I didn't have a great milk supply and I nursed both my children. And to whatever extent I could. They were supplemented with formula. And I did as much nursing as I could. I used More Milk Plus, which is found at Whole Foods, which I thought was a great way to help. But my point being is that when we nurse our children, we want to take care of their oral health. That is, after they're done nursing, take a towel, clean towel, wet it, and then wipe their gums because what does milk have? Sugar. And you can have usually babies about 6, 7 months will start erupting their first tooth. Some maybe a lot longer. So maybe some children are born with teeth. So you want to clean their gums after they're done nursing. That was the point I was trying to make. So it's not only for the mother to have good oral health, but also to the child, and not to have the baby sleep with a bottle. If they do, use water, not milk overnight, because all you're doing is pooling all that sugar in their mouth and you're going to end up with decayed teeth in young kids. And yes, there are 2, 3-year-olds who've needed all their baby teeth restored or extracted because of this. And that was a lot of practice back in the day, like eons ago. And definitely with education and awareness, it's no longer as much that it was before. But it's very important to have good care for your babies, even though you think they had no teeth. And, I also wanted to make another point that you talked about as we get older, how our bodies change, just with pregnancy, just with younger kids, what kind of medications that we're taking changes. So if you're on a high medication or if you've had some sort of radiation therapy, you may have a dry mouth and that changes your it affects the rate of cavities you get or more decays or bad breath just because you don't have that natural saliva. And so to drink lots of water or choose sugarless gum. Sugarless gum is good. And or candies that does not have sugar. And if I was to pick a candy or a chocolate, I would pick a chocolate because candy, you're constantly like lollipops and stuff, you're constantly bathing your teeth with sugar. So I just wanted to bring that up when you brought about older kids. But as far as with nursing, definitely keeping up. You have to take care of yourself before you can take care of the baby, right? Just like when they tell in the airplane that put on your oxygen mask first and then help the child. And it's the same way. Your body cannot nurse well or take care and the healing after whether you have a cesarean or a natural birth. Your body needs time to recover and heal while you're taking care of a young one. So make sure that you don't ignore your health systemically or orally while you're taking care of a young one.
I thought it was a good visual representation for a lot of examples that you gave there. So thanks. And I certainly was not aware of a lot of that. I was a very young mother. And so, it took me a while to learn a lot of things. And I think kind of comparing that to the other side of the coin that you mentioned, like as we get changes, like our mouth might get dry, the first thing that came to my mind was, yeah, I'm in perimenopause and menopause, and a lot of our listeners are kind of in that age range. And so we're looking at increased risk of things like osteoporosis.
Right.
And it was kind of a light bulb moment for me, like, oh, that's also means increased risk of more cavities or oral health issues as well, which is something I hadn't really thought about. So thanks, but no thanks for that reminder.
Sorry.
And so I guess that leaves me to where I had my personal confession earlier about having a hard time with dentists. And, you're a lovely person. I don't know why. I just am one of many people who have kind of a fear of dentists, or it feels very dangerous for me. Like, I don't know what that is. And I have to kind of say to myself, I have to do a lot of reframing. Like, I'm safe. There's nothing here that's problematic. I've talked with these people. They know that if I need a break, they'll give me one, like these kinds of things. And I think, my advice would be definitely have a conversation with your dental office before you go in. Like, I fully confessed I had not been to the dentist and it was almost 10 years. Please do not shame me. Please do not, like,
Yeah,
do any of this, because then I'm just going to not come back. Like, if I feel a certain way. And they took that and were so helpful. And I think if we can have conversation and make people aware of how we're feeling, or to say, hey, I feel uncomfortable at the dentist. I have a fear here, like these kinds of things, it can make it go more smoothly. From
absolutely.
from your perspective, what is helpful in terms of giving people more confidence and comfort in finding a practitioner that would be a good fit?
I'm going to talk on both sides, from the patient side and as well as the dentist side. Yes, it is definitely a daunting to come into a room and you feel a little confined and you're on a chair, you're lying down, you're looking, I have a TV, but you may be looking at a ceiling. But having those conversations prior, what you addressing your fears, because it can be claustrophobic for some people to be in the dental chair and you have two people looking over you and you're stuck. And even if you do sudden, for us, we're using drills that are going at 200,000 reps per minute. We're inches from the brain. We're fighting a lot of battles of our own. We've got ton of saliva. We got to get that suction thing. We got the tongue moving. We've got the cheek, and we're
You're
working.
not helping me right now.
I know. Perhaps talking about the other side, that we are working in a tight environment. And so we want to make sure that you're comfortable so that we can do our jobs. So what you brought up saying, I'm not comfortable, this is not my happy place. These are my fears, and addressing them so that the dentist knows where you're coming from. There are people who love coming to the dentist. Oh, I love this great clean feeling. But then there are people who are like, oh, that. And you know what? I know, like, okay, I don't, when patients talk about needles and then they're like, oh, you're going to inject me with what? And then I'm like, okay, so you don't like needles. I'm not going to talk about it, nor am I going to show it to you. And we can discuss other modalities. Like I have nitrous oxide to help calm the patient and get them a more relaxed place, and we're like, okay, we'll put some music on for you. Let's get a show on, something that'll take your mind off being here. Let me see what I can make to make you more comfortable. There are some dentists that have therapy dogs in there to help. So there are people who have different ways of doing treatment. But again, it's voicing both sides, because I agree we're not the most, nobody's very excited to come see us. People are excited to get their hair done and look fabulous, get their nails done, and and you feel good. But you're coming to the dentist, you associate it with pain and discomfort, but it shouldn't be. And the whole idea, then that's what my whole practice is, that is such a patient centric, that I'm not rushing from patient to patient. I'm here and you have my time. You're here for me. I'm here for you. You tell me what is your fear factor, or what is the most, I know you don't like the sound of the drill. I'm sorry, you cannot change that. Maybe get headphones, get some music there. That'll take your mind off of it. It's just these little things that can help. But communication is the biggest key. If I don't know what's your trigger, then I won't be able to help you. So having that open communication is so key. People who are a little introverted, they can shoot out an email before, they don't want to voice it. They can say like, hey, just before I come to the office, I just want to let you guys know, so on and so forth. And it's very interesting. Like even during COVID, when we were in the peak of COVID and offices were closed, when we started opening, we used to take temperatures of patients. And we used to use a handheld thermometer, right? That you point to the head. And some patients didn't like that you're pointing something that look on top of their head. And so we would point it to their wrists instead. So it's knowing and just communicating. There's nothing that I have not heard. There is nothing that will make me think less of you. There is nothing that will shock. You are healthcare professionals. We deal with people. People come with a range of, fears or apprehensions, and it's perfectly normal to have them. And that's another thing. Like, you shouldn't feel shame that I am scared of coming. I'm not going to go, because you're not helping yourself. There's no shame in that, but it's acknowledging it and saying that, yes, this is it. What do you think you can do different to help me? And find a practitioner who will listen.
Yeah, I love so much of that perspective. And it was especially helpful for me when you said people love getting their hair done or their nails done, because I'm one of those people. And I started thinking, like, what is the difference between me getting my nails done and going to the dentist? Like, there are similar tools. There are some, like, there's a lot of different things. And it's because I do think that there was probably some, trauma or mental block around all of the cavities and problems that I had when I was a young child. And I'm also a redhead. And so there's a whole thing about how we have more difficulty with the pain medication that you
Yes.
prescribe. You're nodding your head for listeners that
Yeah.
can't hear, who might be mind blown by this factor.
Yeah.
And my dentist, a lot of people didn't know that years and years ago. It looks like it's more well known now, but to Novocaine in particular, my body does not respond the way a typical person's body responds. And I imagine that when I was a kid, I didn't have the words to share that I wasn't properly numb, and probably had some pain and different kinds of things about that oral care that I got. And I think it created this like block in my head about the dentist when I've actually never, like, people have been lovely to me, and I do like my teeth to feel clean. I do want healthy teeth. Like, I don't
You
know
have a
why.
beautiful smile. You want to show it off. Yeah.
I know. And you know what? I've never had braces or anything. So whenever I go to the dentist, they're always like, well, I don't understand how your teeth are so healthy. And I'm like, I just brush my teeth and it floss. Like, I don't know. But my poor husband and my kids, two of the three of our biological children, got his teeth. And the one that loves hygiene has my teeth. And, he's the one who wants the electronic toothbrush. Yeah. Anyway, I think we shared a lot of different ideas with listeners, different products they can use, different conversations they can have with their dentist, different ways to approach a balance between Eastern and Western kind of medicine approaches, or what I would call preventative versus, kind of what did I call it? Triage or recon after, right? Defensive kind of approach. But I do always like to leave listeners with something that's positive and actionable on their end that they can take to either be of service to work on themselves or potentially for other people. So, for parents, like, what can they take away from this to help their children have a positive relationship with oral care and dentistry? I'd love to hear any specific ideas that you have for people to kind of take away and implement in their lives.
Sure. So, you bring a great point that, yes, redheads have a harder time getting numb. Novocaine doesn't work very well. And what you
What
experience,
is wrong with us?
nothing is wrong with you guys. But, with children, the point I wanted to make was having that traumatic experience can well work its way into. And I hear that, people who they're like, oh, I never went to the dentist, or they've come from different parts of the world. We didn't believe, or my parents didn't, though their teeth are going to fall off. And I had a bad cavity and the doctor didn't use anything and pulled it out and it was so traumatic. And I hear all the stories. And so my focus when I see my children is, tell, show, do. I show them what I'm doing. I show them the instrument, what it's going to feel like, what it's going to sound like before I actually do it. And with children, it's so hard because, as a parent, you're coming in, you may have preconceived notions, but you don't want to implement them on your children. So you may have had a bad experience like you did, but you don't want to implement and tell your child that's going to be the worst experience of your life. It's going to be fine. Again, first visit that I do, depending on the age of the child, is like a happy visit where I'm just having them ride up and down the chair. These are my little kids, like under 3. Like, hey, we're just gonna see, this is a fancy chair. It can go back. So they're comfortable in sitting in this giant chair. And then just show them like a little mirror looks like. And have them hold the big mirror so they can see what I'm doing. So it's not alien to them, and it's not that they don't have autonomy over it, that they are have some control, like, "Oh, okay, she's just taking a look and we're counting and we're singing the ABCs." So with my young children and even as they're older too, you know, like 6, 7, preteens, again, I will tell them, I will say that if you need me to stop, I can stop. You know, mom's right here. Mom can stay in the room. Mom can stay outside the room, whatever you want. And, taking a child away and getting treatment, sometimes the child feels fearful of that, or they reflect. If the parent is scared and is worried, that doesn't help either. So, it just depends on the parent child relationship. But parents are always welcome to sit in the room with them, to ask questions. And again, patients are always told, this is what we're going to do. This is what going to feel like. It may not taste yummy, but afterwards we'll get you a prize or something to help, you know? And when they're teenagers, and then we can have a little bit more in-depth conversations, how their actions are so important that if they're not accountable for themselves, I can't help them, you know? That you have to brush your teeth. You have to take care of them because they have to they have to have some accountability of what they're doing. It matters, just like anything else. So, but again, even with children, they are much wiser than we give them credit for. They are resistant. I mean, they will blend with the change. They won't have any experience, and so not to have parents negate it or tell them about their bad experience, but say, hey, we're going to the dentist. They're going to count your teeth. They're going to check your teeth. You can read, there are lots of books out there visiting the dentist. There are lots of little, you know, clips about what to experience at the office and ask questions like, hey, what are you doing? What are you doing to my child? And a lot of the young parents or the young children, I'm talking about the fluoride. I'm talking about use of the pacifier, past age 3. We don't want a pacifier. It's going to create issues with the jaw. Or we're talking about thumb sucking or any other functional habits that are inhibiting. Are they grinding their teeth at night? Children should not be grinding and snoring. Are they having some space issues? Do we need to get an early orthodontic treatment? So a lot of the visit at the dentist is not just we're checking your teeth and cleaning. It's a host of other things. What is their diet like? What's their fluoride consumption like? What are the brushing techniques? Are they brushing twice a day, once a day? Do they like it? There are all these other things that we're talking about.
Well, that's super helpful. And I know a lot of those things have helped me, and I'm not a child. So hopefully it can help other listeners as well. Doctor, I just want to thank you so much for being here and being open to have this conversation and all the work that you're doing. I want to point our listeners, you can find Dr. Parul at PDMFA Family Dental and under the same social handles. And we'll put a link in the show notes. But that way we can all kind of follow along the work that you're doing and education. And listeners, thank you so much for being here. We'll share what we really thought. I have I want to have this conversation about redheads over on patreon.com/the whole view because it is something that like I found it. I thought it was a hoax on the internet. And then like
Huh?
every time I've only needed Novocaine twice, but like every time that I have, it has not worked for me. I actually had to come back to the dentist once because it was like an hour and a half and 3 shots. And it's still, I could feel it. And the dentist was like, I don't know what's wrong with you. Just come back another time. I don't have time for this anymore. Not a dentist I see anymore. But anyway, so the best place to ask questions and to support the show that we create and produce ourselves is over on patreon.com/the whole view, which you'll be able to hear our conversation if you're curious about that. And another way to support the show is just to leave a review or hitting the follow or subscribe button, whatever you're using, so that others can find us as well. It really helps, and we appreciate all of those as much as you can take. Just 30 seconds right now. You're listening in this very moment. Just go tap leaving a review, and it would be a big help. And as a reminder, we put the list of resources into the show notes for you at realeverything.com. And I want to thank you again for tuning in today. We appreciate your willingness to be open to growth through your own personal changes. No one is perfect, especially me avoiding the dentist. But in listening, learning, and unlearning, we can become better versions of ourselves. Thank you, doctor, so much for being here.
Thank you so much, Stacy.